Part 4. Social care, charities, violence, abuse, and the need for real protection. Abuse and violence in social care and the wider third sector remain largely invisible to the public, yet the evidence is unequivocal. Abuse and violence are widespread, severe, and worsening. The latest 2025 national study by the Vision Research Centre found that the second highest risk of workplace violence across all UK industries falls on the combined health, residential care and social work sector, which is a stark indicator of how routinely exposed frontline care staff are to danger. Further research deepens this alarming picture. A major survey of UK social care workers reported that 22% had experienced physical violence at work, while more than 94% had suffered some form of abuse, whether verbal aggression, threats, intimidation, bullying, or harassment. Many respondents described being kicked, bitten, spat at, punched, or having their hair pulled. These are not isolated incidents but everyday realities for a workforce already stretched by low pay, long hours, chronic understaffing, and insecure contracts. The emotional toll is profound. Stress, burnout, anxiety, and long-term mental health problems contribute directly to high turnover, destabilizing a sector that cannot afford to lose experienced staff. The picture is just as troubling in the third sector. Charity workers and volunteers supporting homeless people and other marginalized groups increasingly report threats, targeted harassment, and aggressive behavior. Some organizations warn of a growing culture of fear as staff deal with hostility fueled by political polarization, misinformation, and rising social tensions. What binds all these experiences together is a fundamental failure of protection. These roles, whether in care homes, supported living, domestic violence services, crisis charities, are essential to the functioning of a humane society. They safeguard people who cannot always safeguard themselves. Yet the workers fulfilling these responsibilities are too often left exposed, unprotected, and unheard. Real protection means more than policy statements. It requires mandatory reporting systems that staff trust, employers who act decisively when incidents occur, proper staffing levels, training that goes beyond box ticking, and legal accountability when organizations fail in their duty of care. It also requires trade unions, regulators, and the government to treat violence against care and charity workers as the same as emergency frontline roles. Stephen Morris, General Secretary, Workers of England Union, said, "Where employers fail to act, the Workers of England Union will help its members who want to take it further. If you have been assaulted, harassed, or abused by a patient, a member of the public, a colleague, or a manager, you are not alone. The WEU is here to stand with you, to challenge unsafe practices, and to support you in taking the matter further with your employer. Contact the Workers of England Union office immediately if you have experienced any form of violence or abuse at work. We will make sure your voice is heard and your employment rights are defended."